Hello and good evening to all of you. So it's going to be a new module today, oncology. And there can be scenarios like on cancer of ovary or complex ovarian cyst, where whether the RMI is very high and there is increased chance of cancer of ovary, then endometrial cancer, atypical endometrial hyperplasia, where the patient has fertility wishes, cancer cervix, and cancer vulva, where you have to discuss the MDT letter. Cancer genes are also important, and Lynch syndrome is also an important scenario. So, like if there are scenarios of breaking bad news, then yes, you have to be very empathetic. There are some scenarios in the exam where the patient already knows about the diagnosis. So you have to take the station forward. You have to discuss the further management like chemotherapy, radiotherapy, or surgical treatment, and discuss about the side effects and complications of these treatment. And the further follow-up is, of course, important. Putting them in touch with the counselors, that is also important. So let's start with our stations. So I need someone who is going to present first. Anyone? Or I will take the name.
Yeah, I can do.
Yes, Shweta.
Yes.
Fine. Okay. Any random station. Okay, take your 2 minutes.
Yes.
You have 2 slides.
Yeah. Next slide, please.
Yes.
Next one. Yeah, previous one, please. Can I start?
Yes, start please.
Okay. Hello, I'm Dr. Sweta, one of the doctor in gynecology clinic today. Am I talking to Mrs. Naomi Joseph, 55 years old?
Yes.
How can I call you?
Call me Mrs. Joseph.
Mrs. Joseph, I understand that you are here because you have undergone biopsy test done and you are here to discuss about the report. Is it so?
Yes, actually, I'm very much worried about my report. In fact, because, my GP referred me to the skin doctor and he was saying that there can be some abnormality down there. So can you discuss the result first?
Yes, Mrs. Joseph, whatever as you wish, we all are here to support you. Okay. So, Mrs. Joseph, I have your report with me. I have confirmed your name is an NHS number. So I can see that you are alone. Do you want someone to be here with you?
No, it's okay. You can carry on.
Mrs. Joseph, I have to give you a lot of information and I am concerned about that. This I have some concerning news for you. The report that has been provided to me and the biopsy was done, it shows that there is a vulval intraepithelial neoplasia that is stage 2 and it has developed on the previous lesion of lichen sclerosis. So are you aware of what is vulval intraepithelial neoplasia?
No, I don't know. What is it? The name is so. difficult for me.
Yes, we call it VIN. Actually, let me tell you, explain this in simple way. Like the skin of vulva. Vulva is the. Let me draw this for you. Vulva is the area which surrounds the vagina down below.
Mm.
So, am I clear?
Yes.
So in this lesion, there are abnormal changes in the cells of skin of vulva, and these are graded into three types, like type 1, type 2, and type 3. So type 1 is where abnormal changes are into the lower third of skin and depth of skin, and 2 is where up to the middle part of skin is involved, and when whole thickness is involved, we call it VIN3. So, regarding this, the abnormal changes means that cells are abnormal in shape, size, and architecture. They are not the normal cells. And the concern is that in 5 in 100 cases that can progress to cancer, Mrs. Joseph. I am really sorry to be bearer of this news to you.
Oh
Are
my
you with
God.
me?
Yes, yes. So there is chance that I can have cancer after few years.
Uh, it yes, Mrs. Joseph. Actually, it takes long to develop. So, but there are chances that it can develop. So it
Mhm.
needs treatment for that. Okay.
Yes. Okay.
So treatment, yeah. Before proceeding to management, may I ask few questions to know more about you?
Yes. Okay.
Can you tell me what led to that biopsy and about your lichen sclerosis problem in detail?
Oh, yes. So, actually, I had long-term itching and
Mhm.
I was given some medications by my GP. It did not help. Then he gave me some steroids also. That was also not very effective. Then he
Mhm.
referred me to the skin specialist. And as my condition was not improving with the medications, they said that there can be chance that there can be some abnormality. So they did the biopsy.
I'm yes, I'm really sorry to hear all that. You went through a lot, Mrs. Joseph. So don't worry, we all are here to support you in this treatment. And do you feel any weight loss or any appetite change?
No,
Any chest pain and breathlessness?
no,
Any bleeding and discharge from down below?
no.
Okay, so what? So how is the recovery after that biopsy? Is there any pain, soreness down below?
No, there is some soreness, but otherwise I'm okay.
Mm-hmm. So have you ever been pregnant before?
Yes, I have two children.
Okay, so when was your last period?
Um,
I so yeah,
yeah.
have you been through your menopause?
Yes, yes, it is 4, 5 years now.
Okay, are you taking any hormone replacement therapy or any treatment for?
No,
So, any medical illness for which you have been visiting GP regularly, like diabetes, hypertension, any chronic skin condition like eczema,
no,
psoriasis?
no.
Okay. So, any surgery done in the past?
No,
Are you allergic to any medicine?
no.
Okay. So, do you smoke?
Yes, yes, I smoke a lot, so now I'm in touch with your stop smoking services.
Good. I appreciate that, Mrs. Joseph, because that can precipitate the itching and this problem can get aggravated. Okay. So, continue with that. It's appreciable. So, what about alcohol?
Occasionally.
Okay, and I can see that your height weight ratio is 25. So it's good. And yes. So, and how is the support at home?
Yes, my partner is there. He's very supportive.
Hmm. So, is there any family history of any clots and cancer?
No,
And what about your mood these days? Like low, down, depressed, do you feel?
mm, no, but after listening to the result, I'm a bit concerned.
Okay. So yes, don't worry. So I'll connect you to the counselor as well, and we have support group as well. You can be in touch of them. Okay.
Yes.
Okay. So Mrs. Joseph, regarding the management, actually, the uh, your care would be under a team of specialists called MDT, like consultant gynecologist, the vulval care team, specialist, nerve, tissue doctor, all would be involved in your care. Okay.
Mhm. Yeah.
And the first of all is that you have already started to reduce the smoking, so it is good. So try to completely stop that. And lifestyle modification is very important. And may I know about your cleaning habit down below?
Oh, yes. Like I was using douche deodorants.
Yeah. So let me tell you that these are all harmful. These can all precipitate the itching and the disease itself. So please avoid using any soap, bubble bath, any deodorant, perfume, and use undergarment, any breathable one. And just you can use emollient if there is itching. And you can use the steroid cream, which helps in improvement of that lichen sclerosis as well. That will reduce the inflammation and improve the soreness. Okay.
Mhm.
And regarding the management, there are some surgical management and non-surgical management as well. In surgical management, there are the if lesion is small, then that can be treated with wide local excision. That means that that part with lesion are removed with extra margin around it, so that we see that it has completely cleared off. And then the second mode of surgery is that if bigger part of vulva is involved, then the whole part would be removed, and uh, that would and that can cause the cosmetic disfigurement, so the skin graft would be required in that. And also there are risk of surgery, risk of anesthesia, and infection, bleeding, pain can happen after that. Are you with me?
Yes. Okay.
Okay. And benefit is that the cancer cell would be uh, precancerous change would be removed from that area. Okay.
Yes.
And let me tell you that this is not a cancerous change, but one step before the cancer. So we would not like to leave that cells as the uh, disease
Okay.
as it is. Okay. So regarding the after that, there are medical treatment as well. So two type of medicines are there. One is called imiquimod and the 5-fluorouracil. The imiquimod is licensed for that, and it kills the cancer cell by increasing the immunity of our body. Okay, so it fights against the cancer cell. However, it can cause the some skin redness, some burning, but it will go off with time. And there are chances that it can the lesion can come back again. And another mode of treatment is like laser and photodynamic therapy, like light therapy. So these all can be done, but these are not very much effective because there are chances that it can come back uh, again. And the most effective treatment is surgical management. Are you with me?
Yes. Okay. Time is up.
So,
Okay. Keep
what
it.
are your thought on that?
Okay. I will think about the surgery. Yes.
Okay, so Mrs. Noemi, as I told you, that follow the general advice as I told you, and then I'll refer you to the MDT and regarding that, and I'm giving you the patient information leaflet about that, and writing back to your GP. Okay.
Okay. Yes. Yes. Okay. Thank you. Everything was okay. You told
No, but
about the vulval clinic when you said MDT.
yeah, yeah, vulval clinic I told.
You told, no? Yeah.
Vulval care team
Oh,
actually I
yeah.
told.
That's fine. That's fine. The word vulval has to be there. Vulval
Yeah,
KT.
vulval care team. Yeah.
Fine. Or the vulval clinic. Yes. GP and self-assessment of the area is also important.
No. Yeah, follow up and that I
Yeah, even
actually
after the
forgot.
treatment.
Yeah,
Yes.
follow up.
Otherwise, fine. Yes. Otherwise, it is okay. Explanation of the condition was absolutely fine. So you explained each and every word. What is V? That
No,
is
but I
vulva.
went, yeah, in haphazard way actually, when not in
Little.
flow, I think.
Yes, yes. You were slightly hesitant in the beginning.
Yes.
So after that, the flow was okay. Because I wanted to know the result first. So usually what happens that everyone is prepared to take the history first.
Yeah.
So then you have to change your mode. Okay, no history, I have to tell the result. Okay, so otherwise it was okay. Um, General measures you told, no douche, deodorants, perfumes. That is also very important point. Because sometimes what happens, the candidates, they discuss the specific measurements, specific management, and they forget the general measures. So simple measures, that advice is also very important. Otherwise, well done. Good. Just because you ran out of time, so your patient safety will compromise.
And yeah, actually, I
Yes.
have one confusion also. In this case, shall I ask about that camera testing of vaginoscopy,
Mhm.
vulvoscopy?
Yes. Yes,
Because
yes.
it is related to lichen sclerosis. In recent talk, I actually read that if it is related to HPV, then in that case, we should tell about that.
Okay, I will review that. But what our concept was when we were preparing, that if it is a VIN3, so there can be chance that there can be CIN also, or even this anal area can be involved. That is why we have to go for everything, endoscopy, colposcopy. But if you have read it, even I have read the new talk, but I think I didn't get that point. I'll read it again. If there's anything, what you're saying, I will discuss in the
Okay.
group. Okay, no problem.
Fog, they have
Maybe
given.
Yes,
I have not, maybe I have not understood that one.
yes. Anyone else? Yes.
Not, yes, ma'am. In the new talk, it has been given like if VAN due to lichen sclerosis means we should not talk about the medical management because they have high risk of going in for cancer. Like that, they have given ma'am one point.
And
Yes,
what
ma'am.
about the
It's there.
pre-op investigations?
Ma'am, that is, they have
Well,
given commonly for that.
common. Commonly,
Yeah,
we will be doing that to
the
exclude.
colposcopy and perineal inspection is for both, but there is no medical management for VIN which is associated with LS.
Right. Okay. What I have, what my concept is that we will discuss about the medical management, but we are going to say that it's not effective and the condition will come back again and it has got the side effects. And pre-op investigations like colposcopy, anoscopy. Okay, I will also review, but I respect your views because you people are reading more than me. I know that. Okay,
Ma'am,
so
one thing, what will be the lichen sclerosis conversion rate is 5%, but if it's VIN, what will be the conversion rate for cancer? It will be same.
mm, no, more than lichen sclerosis.
They
Yeah,
have given ma'am.
TOG
Reason to
says that 50%, 50 TOG.
50, yes. Lichen
50.
sclerosis,
VM.
it is 4 in 100, isn't it? 4 to 5%
Yes.
Yes.
risk.
like
Here it is
those
50%. Of course, VIN3 will be more VIN. All right, so our homework is including my homework. We are all going to read that talk. Just give a quick reading, okay? We know VIN in and out, but there are some points which we have to be thorough because you people are going for the exam, so the information has to be very correct. Okay, so like last time Anita told that it has threatened miscarriage when we were discussing and progesterone. So yes, you were very right. Previous one miscarriage and symptomatic, then we are going to give the progesterone suppositories. Otherwise, no. So there are so many brains working. So all of us are going to open the talk, read it, and we will share in the group. Okay. If there's anything, I will share the screenshot. Fine. Okay. That is why I think you didn't talk about the pre-op investigations, isn't it?
Yes, I got confused
Hmm.
after reading that talk, actually.
Okay,
That's why.
okay. No, confusion is okay. Confusion
Yeah,
means that you people are reading. Yes. Okay.
but I didn't understand completely. So,
Uh-huh. Right. Fine. Otherwise,
Ma'am,
it was
another
okay.
point we have said is the new talk. In the VN3, there is 26% chance of cancer in situ. Like it can be cancer also. Some 26% it can be there also. Like that, it is given, ma'am.
Underlying cancer in the
Yes,
VIN.
ma'am. Yeah, you
Mm-hmm.
please see that you just clarify, ma'am. Yeah.
We will see because here she is a postmenopausal lady and she already has lichen sclerosis. So we have to see in that case, should we go for all the pre-op investigations? But what my concept is, if patient is having VIN stage 3, then what I read was that we have to rule out abnormal cells in the other areas. That is why we have to go for all the scopies. But I will reconfirm it. No issues at all. Fine. All right. So you're in the gynecology clinic. Okay. So this was Shweta's case. Hello, I am Dr. Shweta, one of the doctors in the gynecology clinic today. May I confirm your name and age, please? How may I address you? Thank you, Mrs. Joseph. I understand that you had itching for long time and you had a biopsy done. That is, sample was taken from down below. Am I right? Is there any other and you are here to discuss about your biopsy result. Is there any other concern and expectations from today's meeting? She will tell uh, like you to discuss the result first. Okay. I can see how much worried and concerned you are, and I have your biopsy result in front of me. I have confirmed the name, date of birth, and NHS number. Do you have any idea about the result? I have some concerns regarding your result. As per the result, there are abnormal precancerous cells in the skin of vulva, and this condition is called VIN, that is vulval intraepithelial neoplasia in medical terms. Have you heard about it? She will say, "Oh my God, doctor, what type of term you're using? It is so difficult for me." Yes, the term is difficult, and let me explain it to you. Vulva means that this is the area down below that surrounds the vagina. Intraepithelial means inside the skin. Neoplasia means abnormal changes or abnormal cells. So there are three types of VIN. Type 1 is where the abnormal cells are involving one third of skin thickness of vulva. Type 2, here the abnormal cells involve two-thirds of skin thickness. In type 3, the full skin thickness is involved. And you are having the type 3 VIN, it means that abnormal cells are involving full thickness of skin of vulva. Am I clear so far? Is it a cancer? Even if she doesn't ask, you told it very nicely, and you have to emphasize that it is not a cancer, but need to be treated as early as possible because it is one stage before the cancer. And if it is not treated on time, then it may progress to cancer. Okay, any questions? So uh, I would like to discuss about your further care plan. Before that, is it okay if I ask you a few questions? And I may need to examine you and arrange some tests and then discuss the management plan. Is that okay? I shall also give the written information leaflet about your condition and write back to the GP about our mutually agreed care plan. How does that sound? Can you tell me in your own words why you had the test done? What happened exactly? How was your recovery after the biopsy? Any abnormal discharge, any bleeding, any pain, itching, burning sensation, or change in the skin color? If she already told you that I used to have long term itching and pain and this, then you will exclude the like questions. You're not going to again ask, do you have itching and this? So you people have to ask what she didn't tell you. May I know, do you use soaps, douche, or deodorants or perfumes down below? How about your waterworks and the bowel opening? Any change in the weight or appetite? Is it affecting your quality of life? How are you coping? And I can see you're 55 years old. Have you undergone menopause? And are you updated with your cervical screening and how are the results? Very, very important. HPV vaccine in this old lady, you can skip, no problem. I would like to ask you personal questions. Are you sexually active? And do you have any pain or bleeding after sex? Is it affecting your sexual life? And how are you coping? Have you discussed this with your partner? And I can see if already it is given in the, I will go back, case notes. And if you remember that in the exam, you can just ask that I can see you have 3 children and they were delivered vaginally. Am I right? Okay. And how was recovery after delivery? It was fine. Are you following GP for any medical condition? I can see you are having lichen sclerosis. Are you aware of this condition? Okay, yes, I am aware. Any other problem like diabetes, thyroid problem? Are you on any medication other than the steroids? And any allergy to food, drug, or metal? Any surgery on your tummy or down below? Any family history of cancer of vulva or any other cancer? And do you have enough support at home? Whom do you live with? Is your partner supportive? May I know, do you smoke cigarettes or drink alcohol? Okay, so she is trying to quit smoking. I appreciate that. And how have you been feeling lately? So I'm feeling very low now after coming to know about the result. Yes, I can see that. So we can also put you in touch with our counselors. Will that be okay? Thanks for these informations. Would you like to add anything important? So regarding your further management, it's going to be a shared care. I will be involving my consultant, the vulval specialist, specialist nurse, and the counselors and the GP. So the treatment options available are, we have surgery, medications, and the laser. And I will also be talking about the general vulval care. So regarding the surgery, in this we remove the abnormal area and it will be sent to the laboratory for testing to rule out any sinister changes. And before the surgery, we will be offering you some tests, that is the telescope and camera test to assess for any abnormal area in the neck of womb, down below and in the back passage. If any abnormality is present, then more extensive surgery will be needed and large part of vulva will be removed. This can cause some defect in area, which will be repaired and reconstructed using muscle and skin from other parts of your body, like thighs. This will be done by the expert surgeons and plastic surgeons. The benefit of surgery is that it will remove the abnormal area, but you can have some risk like pain, infection, bleeding, clots in the legs or lungs. Any questions so far? There are also some medications, but they are not licensed and they are not very effective. Upon stopping medication, the condition can come back again. And there is a medication known as imiquimod, which can cause pain, redness, and flu-like symptoms. Again, we have like treatment with the laser done by the experts. Also, it is not very effective. Condition can come back again. And we can also use the photodynamic therapy, in which photosensitive medication and light source is used to destroy these abnormal cells. Again, this is not very effective and condition can come back again. So do you have any preferences, any questions so far? Then regarding the general measures and vulval care, I would like to tell you to keep the area clean, avoid using soap, bubble baths, and take shower rather than bath, avoid deodorants, douche, perfumes. Just few lines enough, and wear loose fitting cotton undergarments. Follow-up is also very important. For that, you will be asked to come in the vulval clinic. And again, the area down below will be seen with the help of the telescope and a camera to rule out any abnormal changes. And this will be at frequent intervals, every 6 months for 2 years and annually for 5 years. So the total duration of follow-up is up to 5 years. And the follow-up is done to see if there is any, because there is risk of recurrence, that is the condition can come back again, and there is risk of progression to cancer. If you remember what is the risk, what is the percentage in the exam? Yes, you can say that. Self-examination is important. If you notice any abnormality like lump or mass or have any concern, inform us immediately. So as you are trying to stop smoking, continue doing that, because it will, otherwise smoking can also have harmful effect. And continue your treatment of lichen sclerosis. We can also put you in touch with the psychological counselors. Any questions? So I will be arranging appointment with my consultant in 2 weeks' time. I will be giving you the contact numbers and support group number as well. Any questions? Okay. If scenario is changed, young patient, history taking, everything will be same. And this is from the new talk. So for the young patients, the first line is medical. Although we know that medical is not very effective, but they are doing the conservative management first, then laser, then photodynamic therapy and wide local excision. Because what the talk says that in these patients, they are young, sexually active. So if we will do the wide local excision and we remove the area, then they are going to have this psychosexual morbidity because of the defect in the area. So to prevent that trauma, they are offering the medical treatment first. They are starting with the medical treatment first. Okay, so our homework is we are all going to revise this talk nicely. The scenario can change. Instead of post-menopausal, you can have a young patient also in the exam. So your treatment will also be changed. You are going to start with the simple treatments, medical, laser, photodynamic therapy, then surgical treatment. Okay, Shweta, otherwise well done. Fine. We will sort out the queries.
Actually,
Okay.
I got confused in this station initially.
There was confusion, lot of confusion, even last time. But when we did this case, even in the last batch, the same confusion was there. But my understanding was that we have to do the pre surgical investigations. That is why I did not remove it. But again, I'll go through it. In fact, we all will go through it. Okay, no problem. Let's continue. Yes, next one. Anita,
Yes, ma'am.
come.
Yeah.
Candidates from India can do first, otherwise I know it gets very late. After that, we can have other from other countries. Yes, take your case. 2
Yeah,
minutes.
ma'am.
Yeah,
Yes, ma'am.
2 slides.
Next slide, ma'am.
Yes.
It did not change. Yeah.
You can see?
Yeah, I can see, ma'am.
Okay.
Yes, ma'am. I'll start.
All right. 1 minute. Yes, start, please.
Hello, I'm Dr. Anita, one of the doctor in the gynae clinic. May I confirm your name and age?
Yes, I'm Karen Williams, 38-year-old.
So can I call you Karen?
Yes.
So Karen, I'm aware you had a hysteroscopy biopsy done for your heavy bleeding, and you are here to discuss about the report, right?
Yes.
And Karen, also you have been waiting for quite a long time outside. So I apologize for that, and we'll make it sure next time you don't have this kind of you don't have to wait so much. Okay, if
Okay.
you want, I'll continue.
Yes. Okay, fine.
Okay. So Karen, first of all, I'll discuss about your condition. I'll also tell about your reports, and later on we'll come to the management plan. And is it okay for you if I ask you a few questions?
Yes.
Okay. So can you tell me, why was the biopsy done actually?
Oh, yes. I used to have very heavy periods and I was given treatment for that. And I did not take hormonal treatments because, I want to have a baby as soon as possible. So, with these medications, there was no improvement. So I was referred to the gynae clinic and I had this biopsy done.
Okay. So are you experiencing any kind of changes in weight,
No,
change in appetite?
no.
or any kind of like abdominal bloating?
No,
Do you feel lethargic or tired all the time?
no.
Okay. What about your water walks
Yes, they're normal,
and your bowel habits?
normal.
Okay. And apart from any other like medical condition like raised blood pressure, sugar, you have?
No, no, not at all.
Okay. Any surgeries in the past?
No,
Are you taking any medication like over-the-counter drugs?
no,
Okay. And any significant family history of concern, especially cancers of the womb, breast, or bowels, and even the ovaries?
no, no, not at all.
Okay. And how about as you want to conceive, right? Any previous pregnancies?
No,
No. Okay. Are you on any other treatment at the moment?
no.
Okay. Do you smoke?
Well, now I'm trying to quit smoking.
That's very nice, Karen, and I appreciate you. But it's always smoking has had no health benefits, so it's always advisable if you can stop it totally. And also, we can help you by referring you to the NHS Stop Smoking Services if you allow us.
Okay.
Okay. How about any alcohol,
No,
any recreational drug?
no.
And Karen, as you told me, you were having heavy bleeding. So I would like to know, like, when was the last period this time?
Yes, that was 10 days ago.
Okay, and what about like, do you ever bleed in between your periods?
No.
Okay, are you updated with your smears?
Yes, they were normal.
And as I told you, as you told me, you're sexually active, right?
Yes.
So any bleeding you have experienced after say, having intercourse?
No, no.
Okay, what about your blood group?
A positive?
Any reservation you have to blood transfusion?
No.
Okay. Thank you so much for the information, Karen. Karen, I have your investigations report with me. I'll just have a quick examination of your tummy and also down below to see if there is any abnormal discharge and if you allow in presence of the saffron. Is it okay?
Yes, that's okay.
Okay. I've also been provided with your BPs and I can also see your weight is 32, right?
Mm-hmm.
Okay.
Yes.
So coming to your investigation, I have confirmed it with your name and NHS report. Karen, I have a bit concerning news for you. Actually, the report which says, which I have is it says the inner lining of the womb is thickened and there are some abnormal cells with abnormal features. Okay, which
Okay.
means in medical term we generally call it as atypical endometrial hyperplasia. So let me tell you, what it means is at the moment, these changes are not cancerous, but on the long term, if treatment is not taken properly, it may get converted to cancer.
Mm-hmm.
Okay.
Yes.
Hello. So we have seen around around 24 in 100 over a period of 9 years may get converted into cancer. So generally treatment is advocated. And in this case, the best treatment which we say is removal of the womb. Okay.
Oh my God. So you're going to remove my womb, then how am I going to have a baby?
Yeah, I'm aware, Karen, as you want to conceive. So we have another options available for you. What we will do is initially, first of all, your care will be under a team of doctor, which will involve my consultant, the cancer specialist, the specialist nurse, and also the scan specialist and the tissue doctor specialist. And all this, after that, we need to evaluate you. We need to do a few more investigation to rule out all your chances of cancers. Like we'll do some CT scan to check on the check on the ovaries so that there are no cancers of the ovary. As we have seen, around 4 in 100 women have associated ovarian cancer with this condition. Okay.
All
And
right.
also, we'll be doing a few protein markers like CA125, where these are protein markers which tells about, which generally rises in sometimes in general conditions like any inflammatory condition, or sometimes even in cancerous condition, okay?
Yes.
So after evaluating you thoroughly, we may give you an option of hormonal therapy.
Mm-hmm.
So the hormonal therapy will be in the form of the coil, which we call this as Mirena. Generally, this hormonal coil is inserted in the OPD, where it will be placed inside your womb, and it will be left for a period of around minimally for a period of around 6 months. Okay, and we'll be closely following up a 3 months interval,
Okay.
and with a biopsy report. And once your biopsy report are again negative, then at that time we'll be referring you to the fertility expert so that they can you can have your family completed and get conceive as soon as possible.
Right.
Am I
Okay.
clear so far?
Yes.
Also, Karen, let me tell you the definitive treatment in this case is always removal of the womb. Okay. So once your
Mhm.
once you plan your conception and you have your child, at that time we'll again refer you to the specialist doctor, and then we'll plan out a removal of the womb.
All right.
Yeah. Also,
Okay.
Karen, there are other options. If there are other also options also, like sometimes if you don't wish to have this coil inserted, we have pills. We can also put you on hormonal pills, but we have seen the coils work much better than the pills. Okay.
Yes.
Okay. And then like in any time, like in the future, if there are other options also, suppose you opt for removal of the womb at the moment. In that case, what we can do is we can remove your womb, but your ovaries will be preserved because you are at 38 years of age,
Hmm.
and then we can refer you to the fertility expert, where you can opt for you can go for special treatment which is known as test tube baby, where they will do a genetic and pre-GD, that is pre-genetic testing of the eggs, and they can fertilize with your partner's sperm, and they can put, and then it can be carried in someone else, which is known as someone else womb, which is known as surrogacy.
Yeah, but at the moment, I would like to carry my baby in my own womb. So I'll think about the options which you have told.
Mhm.
Okay.
Okay, so
And
Karen,
what is the chance of this condition converting or progressing to cancer?
yeah, as I told you, Karen, over a period of 9 years,
Okay.
24 in 100 may get converted into cancers. Okay. So,
Yes.
what I'll do is I'll write back to your GP also, and I'll also get all the testing which are needed for you, and we'll follow you up in 2 week at 2 weeks interval again, and the treatment has to be planned out accordingly. Okay.
Mm-hmm. Yes.
I'll also
Okay.
provide you with the patient information with it. Anything else, any
No,
concern you have?
no, no. Thank you.
Thank you so
Very
much.
well done. Just now the bell rang. Okay. Good one. Very nice. Okay. So from my side, I think it's going to be pass in all domains. I don't think I have to add. Yes, you don't say yourself that if you want to go for the womb removal right now, let her ask because she wants to get pregnant. So uh, what options which you told was absolutely fine because even when you said that your womb is we will be removing the womb, that is a definitive treatment. I was surprised and I said that why are you going to remove my womb? So hormonal treatment and all, that's enough. And then just wait for it. Just ask her, do you have any question? Then she will ask that if we remove the womb now, if you will, if I will get my womb removed now, then how am I going to get pregnant? Then you can talk about that. Okay. Or you can say that women who opt for the womb removal, they have these options available. So you can explain that in an indirect way. That is also a good idea to explain anything. Okay, I'll come to that point and then we will discuss the answer, how we have to say that in the exam. All right, otherwise, well done. Okay. Hello, I am Dr. Anita, one of the doctors in the gynecology clinic today. May I confirm your name and age, please? How may I address you? Thank you, Karen. First of all, I would like to apologize that you have been waiting for an hour, and we will see that it does not happen again. May I continue? Good. Now you people are apologizing. Very good. Well done. I understand that you were having heavy bleeding during the periods and you had the biopsy done, and you are here to discuss your result. Am I right? Is there any other concern and expectations from today's meeting? So then your agenda. So in a moment, in a moment, I'll try to address all your concerns. Before that, is it okay if I ask a few questions and then discuss the result and for the plan of management? I shall also give the written information leaflet about your condition. Is that okay? Can you tell me why the samples were taken from the lining of the womb? And are you still having heavy bleeding? Do you pass clots, any flooding? And I can see you took some treatments. So did you take any other treatment, any hormonal treatment? Okay, no, she already said no, so that's fine. Have you noticed any change in weight or appetite? Do you get tired easily or feel your heart beating faster? You have to just ask because there can be symptoms of anemia. That is why. Do you have any tummy pain, any pain down below? How about your waterworks in the bowel opening? Have you noticed any change in the color of urine? May I know when was the last periods? Are you updated with the cervical screening and how are the results? Have you been using any birth control method? May I know, have you ever been pregnant before? And uh, okay, so she wants to have the child as early as possible. And may I know your future pregnancy plans? Are you following GP for any medical condition? Are you on any medication, any allergy, any surgery on a tibia down below? Any family history of concern like cancer of womb, ovary, breast, or bowel? Well, if she's scared in the exam, well, I can see that you are scared, but it is important for me to know about this. And may I know, do you smoke cigarettes, drink alcohol? Okay, so we can put you in touch with our Stop Smoking and Stop Alcohol services. Pardon me to ask, any recreational drugs? What do you do for a living? Whom do you live with? Is your partner supportive? Have you been feeling low or down lately? If yes, put her in touch with the counselors. I can see your blood group is A positive and your weight height ratio is 32. It is on the higher side. Yes. Here you have to talk about the general measures also. You had few seconds left, so you're going to talk about the general measures, simple measures that because I think you did not touch this point that we will also advise you to try to lose weight and we can help you to enroll in the exercise program. I will come to that also. So don't forget high BMI. This is a risk factor for endometrial hyperplasia, the atypical endometrial hyperplasia. Fine. Thanks for these informations. Would you like to add anything more? So, my dear, if you will not touch this point, then your patient safety will compromise. Okay, I have your report right in front of me and I have confirmed the name, date of birth, and NHS number. Do you have any idea about it? I have some concerns regarding your report. So let me explain it to you. This is the womb and the lining of the womb. So the report is showing that lining of your womb is quite thick than usual and cells are not normal. These are not cancerous cells, but there are chances that these cells might become cancerous with time. Also, there are chances that some abnormal cancer cells may be present in your womb. So there is risk of cancer of the womb in about 4 in 10. And some cancer cells may also be present in the ovary. So this condition needs to be treated as soon as possible. Otherwise, there is chance that it can progress into cancer. So the question asked by the role play was that, so what is the risk of the condition progressing to cancer? So over a period of 9 years, 24 in 100 women can develop cancer. She will be very upset. So, doctor, you're going to say that I'm going to develop cancer. I can see that you are very upset. Yes, this condition can progress to cancer. That is why it has to be treated as urgently as possible. I can see that you're very upset. Would you like to call someone to be with you? Can I proceed? Now, regarding your further management, it's going to be shared care. I will be involving my consultant and the team of experts, including the fertility specialist, the counselor, specialist nurse, and also your GP. So, regarding the management, we treat this condition by surgery in which the womb is removed. Since you want to have a baby, we do have alternative treatments like hormonal treatment, but with these treatments, there is still chance that you may have cancer in future, and the definitive treatment is removal of womb, as this cancer can spread and even lead to death. Am I clear so far? I want to give you all this information so that you can make an informed choice regarding your condition. Okay, so we also have to offer you some more tests, the blood test to check your blood level and to see how your liver and kidney are working, and check a protein which is increased in case of cancer of ovary. You will be offered special imaging done by the imaging specialist to assess your tummy, pelvis, and chest, and to see there is no cancer of womb and the ovary. Once all the test results are available, your case will be discussed in a meeting by a group of experts, including my consultant, imaging specialist, cancer specialist, specialist nurse, and counselors, and they will come out with the best management plan for you. And your wishes will also be taken into consideration, and all this will be done within 2 weeks' time. Any questions? So, regarding the treatment, just keep in your mind so that you don't forget in the exam. You have to talk about the definitive treatment in her case, general treatment, the lifestyle modifications. Don't forget to address this issue of BMI 32. Okay. So start with the definitive treatment first. We will offer you a hormone containing coil, which is known as Mirena coil, and this will be inserted inside your womb. Have you heard about it? Okay, so this is a small device. This will release the hormone, which will help in thinning of lining of womb. It can cause some side effects like irregular bleeding, and during insertion, there can be risk of injury to the womb, risk of expulsion if you have heavy periods, and risk of infection. And it will be inserted by an expert. Follow-up will be done after 3 months, and we will be taking the sample from the lining of your womb. This will be sent to the lab for testing to see that sample is normal or not. So when will I be able to get pregnant? Even if she doesn't ask this question, just continue your answer that once the test result is normal, we will refer you to the fertility specialist so that you can get pregnant as soon as possible. And after completing your family, you can have the surgery to remove your womb. And if she refuses Mirena, then you can say that we also have the hormonal pills, and after the pills, like you have to take the pills continuously, and we will be calling you after 3 months and take the sample to see whether the condition has improved or not. I mean, the result is normal or not. So Mirena is the drug of choice in her case. And pills, you have to say that they are not so effective as the Mirena coil. So now, if you want to talk about this, the womb removal, so you can say that there are some women who opt for the womb removal. They can have like pregnancy, and the baby can be biologically related to them because ovaries will be there, so eggs will be collected, and generally they are mixed with the partner's semen, and this will be done in the fertility center. And resulting embryo, that is, resulting baby, will be implanted inside the womb of another woman who will carry the baby, and this is called surrogacy. Also, now there is the new treatment modality, that is the uterine transplantation. However, it is a very major surgery, and as a last resort, the woman can go for adoption. Okay, so any questions? Also, I would like to advise you that as your weight height ratio is on the higher side, we can put you in touch with the dietitian, and you can have healthy balanced diet. This will help in weight reduction. encourage to do exercise, and we can enroll you in the exercise program as well. Any questions? Okay. So I will be informing my consultant about your case. I will ask the nurse to arrange all the tests. We will arrange another appointment once test results are available within 1 week time. And I will be giving the contact number, support group number. Counselors, we have already discussed. Okay. So now we have the new treatment modality, uterine transplantation. So we are going to talk about this as well. Okay, fine. We have this flow chart. So this is very, very important flow chart. The scenarios can come from here. Our patient had atypical hyperplasia. The treatment is definitive treatment. We know total hysterectomy plus minus BSO. But for our patient, she wants fertility. Okay, so one is observation, so that's not going to be effective. First line is Mirena. We are going to offer the Mirena. Second line is the oral progestogen. After that, we have to go for the endometrial biopsy. So atypical hyperplasia biopsy will be done at 3 months. And if it is normal, we will be referring her to the fertility specialist for the test tube baby. Okay. And like just be aware of all these boxes. How is the management? Okay. Fine. Next. Who is left?
I can do.
Yes.
And Dr. Bushra.
Okay, fine. Okay, 2 slides, take you 2 minutes.
Next slide.
Mhm.
Okay.
You want to start?
Yes.
Okay, start, please.
Hello. I am Dr. Bushra, one of the doctor in the gynae clinic today. May I confirm your name and age, please?
Yes, I'm Mrs. Isabella Jones. I'm 60-year-old.
Okay. How can I address you?
Call me Isabella.
Okay, Isabella, I can understand from your clinical notes you are feeling unwell from last few days, and you have done some blood investigation and ultrasound report, and you want to discuss your result. Am I right?
Yes.
Okay, Isabella, definitely I will address all your concern, and we will make the management plan that is mutually agreed and safe for you. Can I ask some couple of questions to better understand your condition?
Okay, yes.
Okay, can you tell me more about your symptoms? And since how long do you have this complaint?
Oh, yes. I think the complaint is for the last 6 months to 1 year, maybe, but I was not bothered about it too much. But recently, I noticed that I'm having bloating on and off, and even my tummy has become a bit big, and there is some distension.
I am so sorry, Elizabeth. You are suffering from these symptoms. Okay, Elizabeth, and you tell me you have any nausea and vomiting,
No,
any tummy upset, any bowel opening difficulty.
no, I don't think so. I think, yeah, there is some constipation on and off.
Okay, and any water work problem?
I think I go to pee more frequently these days.
Okay. And have you noticed newly onset headache, chest pain, shortness of breath?
No,
Okay. Any leg pain and swelling?
no,
Okay. And have you noticed any unintentional weight loss recently?
no.
And how is your appetite?
Yeah, appetite has become less, and I think I get full more quickly.
Okay. Okay, Isabella, can you, when was your, since how long your peers have been stopped?
I think about eight years ago.
Okay. And are you taking any hormonal therapy?
No, no.
Okay. And were you updated your pap smear?
Yes, they were normal.
Okay. Okay, Alice, how many children do you have?
Yes, I have three children.
And how was the delivery?
That was normal.
And how are the babies now? Good.
Yes.
Okay. Alice, regarding your pregnancies, may I know, you conceive spontaneously, and have you taken any drugs to release the egg from the ovaries?
No, nothing like that.
Okay. And all babies breastfeeding?
Yes.
Okay. And during days during the pregnancy interval, have you used the birth spacing, this double hormonal pill?
Yes, I took that pill for 5 years.
Okay. Okay, Isabella, do you have any medical condition for which you are visiting your GP, high blood sugar, high blood pressure?
No, no,
Okay. And have you any surgeries in the tummy down below?
no.
Okay. And any family history of concern? In the family, any cancer is running, like cancer of womb and breast, ovaries?
My grandmother, she died of cancer of ovary.
Okay. And is your any family member have gone through this screening for the cancer?
No, no,
This genes. Okay. Okay, Isabella, do you have any drug allergy?
no.
And what is your weight to height ratio?
25,
Okay. And what is your blood group?
A positive.
And do you have any objection of blood transfusion if needed?
No.
Okay. Can I ask some personal question?
Yes.
Yes. Do you smoke?
No, I'm trying to quit smoking actually.
Okay, I appreciate Elisabella because smoking is injurious for our health. If you want, I can also connect you to the NHS Stop Smoking program. What's
Yeah.
your thinking?
Okay,
Okay,
fine.
okay. And do you drink alcohol?
Occasionally.
Okay, and using any recreational drugs?
No, no, never.
Okay, and what do you do for a living?
Now I don't work. I'm a housewife.
Okay, and how is the sport at home?
Yes, my partner is supportive.
Okay, do you feel any time low mood and depressed?
No,
Okay, and do you want to add anything that are you thinking this is important to know for me?
Mm, no.
Okay, okay, Isabella, thank for cooperation. And now I want to examine you in the presence of Chapron about your general condition, examination of a tummy to see any mass, any pain, and examination of a down below. It is okay?
Yes.
Okay, Isabella, thanks for cooperation. Now, Isabella, coming back to your lab result and blood test and ultrasound report. I confirm your name and HS number. These reports belong to you. I have some concern regarding your investigation. Do you want to someone accompanying with you?
No, you can carry on.
Okay, Isabella, because I am afraid I have some difficult news for you. The blood test that I have done, this is we check the protein in the blood and it is quite high and it can be raised in some sinister and non-sinister condition. And the ultrasound report is showing there is the fluid-filled sac in the both ovaries. You can see, I will draw for you. This is the womb, and these are the ovaries. And in the ovaries, there are fluid-filled sac that we call the cyst. Am I clear so far?
Yes.
And Isabella, I am sorry to inform you, as per appearance, there are these cysts have some special characteristics. So, as per appearance, they are not looking the innocent cyst. Am I
Okay.
clear so far?
Mm-hmm.
So for now we have some evidence-based calculation in which we use the patient age and the ultrasound score. I mean any special features if present on the ultrasound, and also the protein that we have checked in the blood. We multiply all these things and we calculate the risk of the cancer if the patient has. Am I clear so far?
All right. Yes.
This calculation we call the risk of malignancy index. And Isabella, I am so sorry to inform you, in your case, the risk of cancer is 75 out of 100.
Oh my God. So I am having cancer, or will I have cancer?
No, Elizabeth, at this point of time, we are cannot say that you are having a cancer or not, because we have to go for other investigation. But we will put you as a fast track, and we will do all the management quickly. And for that, I will offer you one special imaging. This is called the CT scan to know is there any involvement of other structures or not, and some blood investigation, liver function test, renal function test, and after that, the team of the doctor, including our gynae consultant, cancer doctor, and imaging doctor, specialized nurses, and tissue doctor, all will be here to help you and support you, and your management will be discussed in this team of the doctor. I make clear so far.
Mm-hmm. Yes.
Okay, and most probably the management will be the surgery, and in which we will open the tummy in the midline cut, and after opening the tummy, we will take some sample inside the tummy, like under surface of the liver and the muscle that separate the chest and the tummy, and also from the tummy lining. And we will remove the womb with the ovaries and tube, and this is called the staging laparotomy. Am I clear so far?
Mm-hmm. Yes.
Elizabeth, I want to inform you, and every operation have some complication. So there is some risk of bleeding, infection, and injury to the surrounding organs like water bags and bowel and blood vessels, and maybe risk of the blood transfusion. And after the surgery, we will send you a sample for the lab for further testing. And when the report will come, then team of the doctor will decide further treatment. I mean, you are needed for the chemo medication. This is called chemotherapy to kill the cancer cell if they are remaining or not.
Mm-hmm. Okay. Time is up. Yes. Keep it.
Okay, Isabella, now I would like to, I will give you the patient information leaflet, and I will book your appointment within 1 week to my consultant, and I will arrange the special imaging scan, this is CT scan for you, and some blood investigation.
And I
Is
have
it?
daughters. So is there any chance that they can also develop this type of cancer?
Yes, Elizabeth, for that, because your grandmother and you are also having ovarian cancer, so I will connect you to genetics. They will do your counseling and do the testing for see any faulty genes running in the family.
Right. Okay. Fine. Thank you.
Okay,
Okay.
thank you.
Okay. Okay. Thank you. All right. Overall, good. Your history was little long. I know you were asking for all the risk factors in the history. Okay, fine. But that will not change the management now. Even if I you wanted to know about this.
Protective factors.
Yes, yes, exactly. Okay. And when I
Yes.
said my grandmother died of cancer, you said, okay.
Oh,
Don't
yes,
say that.
sorry. I have to say I am so sorry for
Yes.
that.
Yes, I know you were happy because I'm giving you some information so that you are going to talk about the cancer genes. I know that because I'm sitting here and we feel happy when the role play gives you some information. But
Yeah.
yes, don't say okay.
Okay, okay, sorry.
I'm sorry for that. This is communication. You know, if the lay examiner will sit there, he will he will not. Your communication with compromise. Your communication is very good. Everyone's communication is very good. But in these informations, when you get such information, my uncle had bowel cancer. Okay, no, because now you know you have to talk about the Lynch syndrome. You have got some informations. So don't sound happy and like, okay, I'm getting some information. I'm sorry about that. How's your uncle doing? I'm sorry to hear about your grandmother. Okay, fine. So you're in the gynae clinic and yes, RMI, you don't have to tell the name that it is risk of malignancy index. Just say it is a special calculation. She will not understand. If it is structured discussion task, you can say that. Okay. So, hello, I'm Dr. Bushra, one of the doctors in the gynecology clinic today. May I confirm your name and age, please? How may I address you? Thank you, Isabella. I understand you are here to discuss your scan results and the blood report. Am I right? If she's too much worried and all, I can see how much worried you are, and I want to discuss my result. Yes, I have your result right in front of me, and I have confirmed your name, date of birth, and NHS number. Do you have any idea about the results? I will give you a lot of information. Would you like to call someone to be with you? I have serious concerns regarding the report. The ultrasound was done and it is showing that there is a large complex fluid-filled space in both ovaries. Do you understand what it means? Let me draw and explain it to you. Or if the scan result is there, you can just show and explain that you can see that there are two types of fluid-filled spaces. These are known as the cyst. One is simple cyst, which contains only fluid. Other one is the complex cyst, which contains the fluid and some blood and solid components, and it is associated with increased risk of sinister changes. And in your case, I can see that you are having the complex cyst, and it is not innocent looking. Also, the blood test was done to check a protein, and it is quite high. It can be high in some sinister and non-sinister conditions. Am I clear so far? So if she doesn't ask anything, I have cancer or what, you will just say that as per the scan and the blood test result, in your case, the risk of cancer is high because like we do a special calculation to assess the risk of the cancer, and it is showing that the risk is quite high. I'm sorry to be the bearer of this difficult news. I can see how upset you are. Doctor, is it a cancer? At the moment, it's very difficult to say whether it is cancer or not. And like we have to do some more tests, and then I will be discussing about the further management plan. Is that okay? So I would like to ask you a few questions to know more about your condition, and then I will discuss the further care plan. Is that all right? I understand you came to the emergency department 2 days ago with the bloating and tummy distension. So, can you tell me in your own words what happened exactly? Can you tell me more about your condition? I'm sorry to hear about that. Do you have symptoms like nausea, vomiting, tummy upset, change in your weight or appetite, any cough or chest pain, difficulty in breathing, any leg pain? How about your waterworks and the bowel opening? And have you attained your menopause? Or you can ask when did you attain the menopause? She's 60 years old lady, so of course she's a menopausal lady. Are you updated with your cervical screening? And did you use any birth control method before, like the hormone-containing pills? May I know, have you been pregnant before? So how was your pregnancy and delivery? How was your recovery? Do you have daughters? May I know their age? All right, so take a note, she's having daughters. So keep that in mind. And are you following GP for any medical condition like diabetes, blood sugars, blood pressure, high blood pressure? Are you on any medication, any allergy, any surgery on your tummy or down below? Any family history of cancer like cancer of ovary, breast, or bowel? I'm sorry to hear about your grandmom. Do you have enough support at home? Whom are you staying with? Is your partner supportive? Do you smoke and drink alcohol, as I'm concerned about your health? Okay, so if she's smoking and drinking alcohol, you would offer the NHS stop smoking and stop alcohol services. Have you been feeling lower down in the last few weeks? I can see, may I know your weight height ratio? 25. Your blood group? Okay, thanks for these informations. Would you like to add anything important? So regarding the further care plan, I would like to offer you some tests. The blood test to check your blood level and how your liver and kidney are working. Imaging test, that is the X-ray of the chest to assess your lung to see if there are any sinister changes or sinister cells. A special scan, that is the CT scan of tummy and pelvis, to see if there is any sinister changes in these areas, and the scans will be done by the scan doctors. Once all test results are available, your case will be discussed in a meeting by a group of experts involving my consultant, specialist cancer doctors, specialist cancer nurse, counselors, scan doctors, and the tissue doctors. And this will be done within 2 weeks' time. They will come out with the best management plan for you, and your wishes will also be taken into consideration. Am I clear so far? Any questions? Now, regarding the management plan, most likely you will be offered an operation. This will be done by opening your tummy, by making an up and down cut, because the cyst is quite large. If the results show that there is low likelihood of sinister changes, even then surgery is going to be very extensive. So let me explain to you in detail about the surgery. This is the womb, the tubes, and the ovaries, and the surgery will involve removing both the ovaries, both tubes, womb, and also part of the fatty layer. Samples will be taken from the fluid inside your tummy and from other organs like liver, diaphragm, etc. If there is very high likelihood of sinister changes, then staging surgery may need to be done at the cancer center involving our consultant and expert cancer surgeon. And there is some risk of surgery. Would you like to know about that? So risk of pain, infection, and bleeding is there, risk of damage to the bowel, bladder, and blood vessel. All the samples will be sent to the lab for testing, and once the test result is available, then we will discuss with you about the further plan, whether you might need some special medications to kill the sinister cells. These are the anti-cancer medications. And as you have 2 daughters, and there is also family history of cancer of ovary, we would like you to refer to the genetic counselor for proper counseling regarding faulty genes running in the family. Any questions? Okay, so I will be informing your GP, arranging appointment with consultant in like 1 to 2 weeks' time, appointment with the counselors, ask the nurse to arrange the blood test and scans, give the contact numbers and support group number. Okay. In the end, if you have time, just say a few lines. Please don't feel alone. We as a team are here to help and support you. Thank you. Okay, here actually in the exam, the information was incomplete. We didn't know about the stage because it was an incidental finding of the complex cyst and high risk of cancer. So you have to talk accordingly. Okay, so what we have to do, so it's going to be the surgery because here now we know that RMI, in her case, she is postmenopausal lady, complex cyst. RMI is more than 200 in her case. And increased risk of malignancy. So we know all the test and CT. After CT, it will be the MDT review. MDT review, they will see whether it is low likelihood of malignancy or high likelihood. So if it is low likelihood, then that will be your like pelvic clearance surgery. Everything has to be removed, okay, done by the trained gynecologist only. But if it is high likelihood of surgery, then it is done at the cancer center and full staging procedure is going to be done. So the surgery will be done to stage your cancer. And after that, the further treatment will depend on the stage of the cancer. So if it is an advanced stage, then it's only going to be the like chemotherapy, or if needed, rarely radiotherapy is given in cancer of ovary. Okay. All these charts is very important. There was scenario in the exam. It came once where the patient had RMI of less than 200, and it was like the cyst was also very small. Okay, no, cyst was not small. I think it was more than 5 centimeters. And she just had one feature, like she was symptomatic, but non-simple features. But just remember, if RMI is less than 200, then there is no need of further CT and MDT. Simple surgery is done, salpingo oophorectomy. And it will be the BSO, the bilateral salpingo oophorectomy. And then the sample will be sent to the lab and further treatment will be done accordingly. Okay. Yes. Who is there? Dr. Shanti, would you like to present?
Ma'am.
Okay.
Yes, ma'am.
Yes, come please. Take your 2 minutes.
Yes, ma'am.
Okay, start please.
Hello, I'm Dr. Shanti, one of the doctor in the Gynae clinic today. Can I check your name as well as age, please?
Yeah, I'm Bennett Hemmings and I'm 28-year-old.
So I can see from your case notes that you are here to discuss about some cancer genes.
Ah,
And
yes. Yes.
so can you tell me in your own words that how can I help you today?
Actually, I came to see your consultant. So can I see him, please?
I'm sorry, my consultant is on sick leave, and I have read your case notes. If you wish, I continue the consultation?
Yeah, okay, that's fine. But I would like to see your consultant once. Will that be possible?
Yeah, definitely. I will arrange an appointment as early as possible with my consultant too. Is it okay for you?
Okay, right.
So, yeah. So can you tell me in your own words, like, so how can I help you today?
Oh, yeah, actually, I have a lot of concerns. I have my mom, and she is just 48 years old, and she has been diagnosed with cancer of ovary. And I came to know that cancer of ovary run in the family. And there are some genes which are responsible for this cancer. So I would like you to get me tested for the cancer genes.
I'm very sorry. How is your mother now?
Yeah, somehow she's coping. Actually, she had undergone surgery and now she is on chemotherapy.
I'm very sorry to hear that. So how are you coping?
We all are going through a very difficult time and somehow we are coping. So
Do
it is
do
very
you
difficult.
want to put in touch with the counselors?
Okay, that would be fine.
Yeah. Yeah. To discuss about the your cancer genes, can I ask few questions to know more about you?
Yes.
So at present, are you having any symptoms like any pain in the tummy? Any pain in the tummy or any fullness after food?
No, no,
Any frequent peeing?
no,
Any cough or breathlessness?
no.
What about your water and bowel works?
Yeah, they're okay.
Okay. So what about your periods? Can you tell me more about your periods?
They're regular. I don't have any problem with the periods.
What type of contraception are you using?
Well, I'm taking this birth control pills
Good. When is your last periods?
10 days ago.
Good. Are you up to date with your cervical smears?
Yes, yes, I had once. So that was okay.
Okay. Do you have any pregnancy or any children?
No,
Okay. So, what about any medical conditions for which are you following the GP?
no,
Uh, so any allergies?
no.
What about the blood group?
A positive?
Any reservation for blood transfusion?
No,
Any surgery in the tummy or down below?
no,
Apart from your mom, do anyone else in the family has any cancer, like your maternal uncle or grandmother or anyone else? Can
Mm,
you tell me?
no, no,
Okay. Do any one of the family members have clots, history of clot?
no,
Do you have personal history of clots, migraine?
no.
Okay. Do you have a few personal questions? Do you smoke?
Yes, I do.
Okay. How many cigarettes?
Sometimes it is 6 to 8 in a day.
Okay. So have you ever thought about quitting?
No, not really.
So actually, smoking has a little bit higher potential towards cancer. So if you think about it, I will put in touch with NHS Stop Smoking Services. How it sounds?
Okay.
So do you drink alcohol?
Occasionally.
Okay, sorry to ask, any recreational drugs?
No.
Okay. So what about support at home? Are you well supported?
Yes, my partner is there.
So what do you do for your living?
I'm an engineer.
Okay, fine. And in the past 4 weeks, have you been ever depressed or anxious?
No, actually, I'm just worried because of my mother's condition. That's all.
Okay. So what is your height to weight ratio?
24.
Fine. Thank you for all the informations. Do you want to add anything else which I should know about it?
No.
Okay. So in the presence of chaperon, I want to examine you. Like I want to examine your tummy, feel of tummy as well as down below. Okay for you?
Okay. Yes.
Okay. So regarding the concerns you have, your from your history, I couldn't, apart from smoking, I couldn't find any other risk factors as such to develop a cancer. Okay.
Yes.
So, but your mom has suffered from a cancer at the young age, 48 years.
Mm,
So all these genetic cancers will occur at young age, but from all from your family history, only one family member is affected. Okay.
Mm-hmm.
So, at this type of genetic cancer, ovarian genetic cancer, only 10% will run as what to say in families. 90% of the cancers arise spontaneously as a one-off procedure. Okay,
Mm-hmm.
so and regarding further management, I will put in touch with the genetic counselors who will trace your family tree, as well as they will just assess all your risk factors, and then they will come to a conclusion. They will do a scan, arrange a scan for you, as well as measure some proteins called CA125 in your blood, and then they will come to a conclusions whether you come under high risk or low risk.
Uh, Can you do the test, because you will be referring to the genetic counselors? That will really take a lot of time.
Yeah, I know that, but at present we cannot do that. So what we can do is, since your mom is at a younger age, since she has suffered from an younger age a cancer, we can first do the genetic test in your mom, and if your mom's test comes positive, then we will arrange test for you.
Mm-hmm. Okay.
Okay?
Yeah.
So you want to know what happens if it comes positive? Do you want to
Yes.
know what will do?
Mm-hmm. Yeah.
In that case, if you're there is if the genetic test comes positive, we call those gene tests as BRCA or BRCA genes. Okay, these faulty genes will cause, there is, if the in the general population, 1.7, the risk of getting ovarian cancer is 1.7%. Okay, if you take 100 women, 1.7% of the women will get cancer. But the women who have these faulty genes, there is 40 to 60% risk of getting a ovarian cancer. So what we normally do is, we ask the woman to complete the family, and after 35 years will go for removal of both tubes as well as the ovaries. Am I clear?
Yes.
So, since the ovary is an important organ which produces eggs as well as an important hormone called estrogen, this hormone is very important to protect your bone, brain, as well as heart. And it is also important for your sexual drive, as well as it will keep the vagina wet, and it is very important for the sexual function. Okay.
Yes.
So once the ovary is taken off, then you'll have dryness of vagina and your bones can become weak. So we have to supplement with another that is what is called as hormone replacement therapy, where we will give the estrogen as well as the progesterone hormone until you reach the age of menopause.
Mm-hmm. Okay.
Okay. The surgery will be done through a small, what is called a laparoscopic method, like um, and it has its own complications. Like during the surgery, we can there is a chance of injury to the bowel, as well as there is a chance of injuring to the bladder as well as blood vessels. There is chance of infection as well as bleeding. Okay.
Yes.
And removal of ovary, but your concern is very much concerned about getting the cancer, but removal of the ovary does not give 100% protection. There is 2% risk of getting a cancer from the lining of the tummy. Okay.
Mm-hmm.
Not 100% protective. Okay. And then sometimes on the removed ovary itself, 4% there is a chance that cancer can be.
Mm-hmm. Okay,
So
so how is there anything which I can do to reduce the risk of cancer?
So there are certain, you have to stop smoking first, and then eat a well balanced diet, keep yourself physically fit, and then you can take oral contraceptive pills. This gives, if you continue for 20 years, it reduces your risk to half. Okay,
Yeah.
50%.
Okay. Time is up. Okay. Keep
So
it.
I'll give you plenty of information. I'll give you the patient information leaflet. So you read all those things, and I'll put in touch. I will put an appointment with my consultant, and I will write back to a GP also.
Okay, fine.
Yeah.
Yeah. Thank you. Okay. Don't
Yeah.
forget this consultant on sick leave. In the exam, you don't know. The role plays can give you very tough time if you will not apologize. She will say, "You did not tell me you are not the consultant.
Yeah.
You are not the senior doctor, and you just want to start the consultation, you know." So, yes, this is your situation awareness. Never forget this one, this part. All right. Otherwise, it was okay. And say little more about 1 minute.
Yeah.
Yes, like you can say a little more about the simple measures which can help to reduce the risk of cancer, pregnancy, and breastfeeding also. Because I'm not pregnant, I'm taking the hormone contraceptives. So yes,
Yes.
just add on these points also, having babies and breastfeeding healthy balanced diet, you said yes. And BRCA gene, when we are talking about the BRCA genes, so we also talk about the breast examination and the breast screening when it is done.
Yes, ma'am.
Yes. So those, just one line about all the points. Otherwise, like it will be information gathering was fine. Okay, communication is also fine. Otherwise, applied clinical knowledge and this patient safety, it will be just borderline.
Yes, ma'am.
So that
Correct.
is the thing. Yeah. And communication, my dear, if you will forget this part, your consultant sick leave, and if
Mm.
lay examiner is also there, then communication will also compromise. And this role player will give you a big headache. So you just have to apologize. That's all. My consultant is not there, and I can carry on with the discussion. Okay. Hello, I am Dr. Shanti, one of the doctors in the gynecology clinic today. May I confirm your name and age, please? How may I address you? Thank you, Bennett. My nurse has asked me to come and see you as my consultant is on sick leave. So, will it be okay if I carry on with the discussion today? If you wish, I can arrange another appointment with my consultant. So, may I carry on? All right. I understand you are here to discuss about the cancer genes, and from the case notes, I can gather that your mom has been diagnosed with cancer of ovary. Either you can start like this, or you can tell me, you can say that, can you tell me more about your concern? What is bothering you? So she can tell about all this. My mom has been diagnosed with cancer, and my mom's age, or you can say, I can see your mom's age is 48. Am I right? So I can see that you and your mom are going through a very difficult time. How are you coping? How is the support at home? And how is your mom doing now? I'm sorry to hear about that. I can see how worried you are. I will try my best to address all your concerns. So, before addressing all your concerns, it is okay if I ask you a few questions to know more about your general health and to know more about your condition, your general health, and then discuss about the cancer gene tests and further management plan. So, may I know, are you otherwise fit and well? Do you have any tummy pain, swelling, or bloating? Any change in the weight or appetite? How about your waterworks and the bowel opening? And can you tell me more about your periods? Are they regular? When was the last one? Are you updated with your cervical screening? And how are the results? I would like to ask you some personal questions. Are you with someone now? Are you sexually active? Are you taking any birth control method? Okay, I'm taking these pills. Since when? So the pills contain the two hormones. Yes. Okay. Have you ever been pregnant before? No, I have not been pregnant. Okay. May I know your future pregnancy plans? Now, if she is too much worried and she says, I don't want to get pregnant, may I know why? Because I'm thinking of getting my ovaries removed. Are you following GP for any medical condition? Are you on any medication, any allergy, any surgery on your tummy or down below? Any family history of concern, like anyone in the family with cancer of ovary, bowel, breast, or womb? May I know what do you do for living? Whom do you live with? Is your partner supportive? Do you smoke cigarettes? Okay, how many in a day? So smoking is has no health benefit. And is it okay if we put you in touch with the stop smoking services? Do you take alcohol? Pardon me to ask, any recreational drugs? And if you have already told about putting in touch with the counselors and all, then you don't have to repeat again. Otherwise, yes, you can say that. How have you been feeling lately? Because throughout the conversation, we have told that I can see that you are very upset and this. So already mental health history is finished. You are done with this. And may I know your weight height ratio? 24. Okay, thanks for these informations. Would you like to add anything important? Now, coming to your concerns, I can see that you're so much worried about the risk of having cancer. So let me explain it to you that, like, you are worried about that the cancer of ovary can run in family. I would like to tell you that cancer of ovary runs in family only in 10%. So what it means that if there are 100 women, then only 10 in 100 women have cancer running in the family. And 90 in 100 women who have cancer of ovary, it doesn't run in family. So you can see that the risk of cancer of ovary running in family is very small. If anyone in the family has the cancer, then the risk is slightly higher. Am I making sense? Now, regarding the cancer gene test, which you are asking, I would like to tell you that, like, I can see that your mom's age is 48, she's quite young, and I would like to know whether she has been tested for the cancer gene test. No, she has not been tested, so I would like to refer you and your mom also to the genetic counselors to go for the cancer gene. Like they will discuss with you about the cancer gene test in detail. And they will also assess your risk for developing the cancer and can offer you this test. So, can't you offer me the test straight away? No, I'm not an expert regarding this test. The genetic counselors are the expert and they will assess your risk first. Like Dr. Shanti said, that they will assess your family tree. Okay. And also, they will be checking your weight height ratio. They will be offering the examination of the breast and tummy. You will be offered some scans of the ovary, the blood test to check for the cancer antigen. That is a special protein which can be raised in some sinister and non-sinister changes, can be raised in some types of cancer of ovary. Am I clear so far? All right, so we have already discussed the point that whether mom has been offered genetic testing. No. So first, your mom will be offered genetic testing. If your mom's tests come positive, then you may also be offered tests depending upon your risk. So may I know, do you have idea about the types of the cancer genes? So there are many types. One is the BRCA1, BRCA2 genes. Then we have the cancer gene for the Lynch syndrome, which can increase the risk of womb and the bowel cancer. Now, genetic counselors will discuss in detail about these cancer genes and tests. So if the test comes positive, it means that your risk of developing cancer is high, but it doesn't mean that you are having cancer or you are definitely going to develop cancer. So if the test is positive, then do you want, like Dr. Shanti asked, if she doesn't ask any question, you can carry on with your station and just say that, do you want to know what will happen if your cancer gene test is positive? Or the role player can ask that, can I get my ovaries removed? So I will like to tell you that cancer of ovary can arise from the ovary itself and also from the tubes. And removing the ovaries and tubes, there is still chance that it can arise from the lining of tummy wall in 4 in 100 women. And like in the general population, the risk of cancer of ovary is about 1 to 2 in 100. Even surgery cannot give 100% protection against cancer of ovary, and it can decrease the risk but cannot eliminate it completely. Then just remember what you have to say, that you have to talk about the risk of surgery, menopause symptoms, HRT, and infertility. So the surgery will be done by the keyhole surgery, and it has got some risk. Would you like to know about them? There is risk of pain, infection, bleeding, damage to internal organs like bowel, bladder, blood vessel. And after the surgery, that is after removal of ovaries, you can have long-term health implications because ovary, they produce the important female hormones, and these hormones protect the heart and bones. You can have menopause-like symptoms like night sweats, hot flushes, vaginal dryness. The bones can become weak and can get fractured easily, and to prevent these complications, we will offer you the hormone replacement therapy, and it has own side effects. Any questions? Also, you will not be able to have babies naturally in future except by artificial methods. Any questions? So regarding the surgery, as your family is not complete, you can have the surgery once your family is complete, only after discussion with the genetic counselors and after the genetic testing. Surgeries are offered between the ages of 35 and 45, depending upon the type of gene. If you don't remember the ages in the exam, and if she asks you, when am I going to have surgery? So you can just say a few lines that at the moment, I'm not aware of it. I will reconfirm the exact age when the surgery is offered in different types of genes. So BRCA1, we know it is done between 35 to 40 years, BRCA2, 45 years. And what type of surgery will be done? It will be removal of both ovaries and tubes and removal of both breasts, depending upon your risk. So removal of both the ovaries, it will reduce the risk of cancer of the ovary by just a minute, I'll have some water. All right. So here, removing both the ovaries, it will reduce the risk of cancer of the ovary and cancer of breast by 40 to 50%. And if you remove the breast, then it will reduce the risk of cancer of breast by 90%. Now, there are other protective and preventive measures which will decrease the risk of cancer of ovary, having healthy lifestyle, healthy balanced diet, continuing the birth control pills with the two hormones, breastfeeding the babies, pregnancy, stopping smoking, having healthy weight height ratio. Also, I would like to advise you to follow up in the breast cancer screening program as per the national guidelines and do self-examination of the breast. So breast screening, you should remember that it is from 50 years until the age of 71 years every 3 years. If there is high risk of cancer breast, then breast screening is done early, like in the early 30s or early 40s, and it is done more frequently annually. All right, so I will be arranging appointment with my consultant and the genetic counselors and give the contact numbers for clinical access. So this is like a negotiating station. So here you can arrange appointment with the consultant, or you can say I will be discussing your case with my consultant as well. And of course, genetic counselor is very important. Now, Lynch syndrome, very, very important scenario. So history taking and everything is fine. Family history, you have to ask about the history of anyone having the bowel cancer. Important in the female. Mostly it is the endometrial cancer. Now, preventive measures, you are going to talk about the simple measures, having healthy balanced diet, smoking, cessation, alcohol reduction, COCP. So this will help to reduce the risk of both endometrial and ovarian cancer. Also reduces the risk of the colorectal cancer, but slightly increases the risk of breast cancer. Mirena, it will reduce the risk of endometrial cancer. Aspirin tablet, very important information you will give to the patient. If the cancer gene comes positive, then we have to give you the tablet aspirin. It will reduce all types of cancer associated with Lynch syndrome, and talk about the side effects of aspirin, that it can cause some tummy upset, some raw area in the tummy, indigestion, or heartburn. That is for gastritis, gastric ulcer. Aspirin reduces the risk of endometrial cancer more in obese versus non-obese. It is started from the age of 18 years. What about the best dose? Still, no one knows, but somewhere it is mentioned 150 milligram as usual, but still we don't know about the dose. Talk about the surveillance method in the simple patient language that you will be offered. Like there are some surveillance method like scan to check your ovary and the womb, the special protein that is the 125 to see if it can be raised in some sinister and non-sinister changes of the ovary, and combination of both. Endometrial biopsy, that is taking some sample from the lining of the womb, and it can be done in the outpatient procedure by the telescope and camera test. It can cause some pain, infection, bleeding, uterine perforation, and very invasive technique. Also, there is no evidence that these surveillance methods are helpful in detecting cancer early, and they are not recommended. Then the bowel surveillance with the help of telescope and camera. Yes, this one is recommended, and this will be done by the bowel surgeon. It will help us to see if there is any abnormal changes in the bowel. Then talk about the risk reducing surgeries in this case. So it is the keyhole surgery in which we are going to remove the womb, both tubes and the ovaries. And this surgery is offered after completing the family. Timing of surgery is the gene specific, mostly by the age of 40 years. Because after 40 years, there is increased risk of the womb cancer. And at the same time, we can also remove your bowel. And this will be discussed with the bowel surgeon. Then you have to talk about the risk of surgery, what can happen. Risk of surgery, pain, infection, bleeding, then damage to the internal organs with the removal of ovaries and uterus. You can't have natural conception. You can have babies by artificial techniques of reproduction. Okay, then talk about the menopausal symptoms and HRT. So she's not having uterus, so it will be only the estrogen replacement therapy. Then you have to talk about the MDT care, that it's going to be shared care involving my consultant, the genetic counselors, fertility specialist, the bowel surgeon, clinical psychologist, and the counselors. Now, if you have any case in the exam where the patient has been diagnosed with endometrial cancer, then you have to screen for the Lynch syndrome as well. Very important. It was not there before, but this is a new information. And because in Lynch syndrome, the risk of endometrial cancer is very high. I think 40, how much I have written? 40, 50%? Very high it is. 40 to 60%. And prognosis of endometrial cancer with Lynch syndrome is very good. 10-year survival rate is more than 90%. Now, if there is a scenario where the patient has tested positive with the cancer gene, or like Lynch syndrome cancer gene is positive, she wants to have baby, healthy baby. So yes, first is the counseling part will be Lynch syndrome has no effect on fertility. So we know it is an autosomal dominant condition. That is, there is risk it can be transmitted to baby in 1 in 2 cases. So we would like to refer you to the fertility specialist. They will discuss with you about having the test tube baby. And this is a procedure which is known as the pre-implantation genetic testing, in which your eggs will be taken, mixed with your partner's semen, and then the resulting embryo, that is resulting babies, will be seen under the microscope. And the healthy babies not having this gene, they will be implanted inside your womb. Okay. That's all. And for the Lynch syndrome, I have my YouTube video. I will share that, but please see that. It is a very, very important exam scenario, how you're going to counsel the patient. Okay. So next is, I think, Bushra. No, Bushra is done. Maria. Yes, Maria. Take your case. You have 2 slides.
Next slide. Right, previous slide. Previous slide, please.
This one.
Okay.
Yes, you want to start?
Yes. Hello, I'm Dr. Maria, one of the doctor covering the gynae clinic today. May I confirm your name and age, please?
Yes, I'm Mrs. Vienna Lawrence, 49-year-old.
How may I address you?
Call me Mrs. Lawrence.
Okay, Mrs. Lawrence, I understand you are here as you had surgery 2 weeks ago and you underwent for removal of the womb. And today you are here to discuss about your results. Am I right?
Yes.
Okay, so Mrs. Lauren, in a moment, I'm going to address your concern. But before this, is it okay if I ask you a few questions to know more about your condition? And then we will discuss in detail regarding your results and further management plan.
Okay.
Okay, so Mrs.
Actually,
Lauren,
I am too much worried about my results. So can you discuss that? Because, I have been called very urgently to discuss the result.
okay, it's okay, Mrs. Lauren. I'm going to discuss first your results. Next slide, please. Okay, so Mrs. Lauren, I have confirmed your results by your name, date of birth, and NHS number. This report belongs to you, and it is showing that your womb and right and left ovaries and fallopian tube were removed. Well, I'm a bit concerned regarding your results. I'm afraid I don't have a good news for you. Mrs. Lauren, would you like to call someone to be with you?
No, it is okay. Carry on, please.
Yeah, Mrs. Lauren, I can see that in your report, there is the cancer in your right ovary. I'm really sorry to inform you this news. I
Oh,
know,
but you're saying I have cancer of the ovaries.
yes, as per your report, it is showing that there's a cancer in your right ovary.
God.
Well,
Mm-hmm.
for further, management, of course, we have to discuss it with, different specialist doctor, and then we will make a further management plan for you. Okay. So, Mrs. Lauren, I want to ask you questions regarding your condition. Can I ask?
Okay, yes.
Okay. Can you tell me why you were advised for this surgery? What were you having? Problem.
Yes, actually, I was there was a big, they said that there's some cyst, and also I was having a lot of bleeding, and they gave me some medications. It was not helpful, and I was 49 years old, so I was told that just get it removed. So they removed everything, ovaries and womb and tubes, everything.
Okay. So, how was your recovery after the surgery?
Yeah, that was okay. That was fine.
Okay, so can you tell me that uh, do you have any history of I'm sorry, yeah. Do you have any history of any uh, decrease in appetite or any weight loss?
I think so. My weight, I think my weight has reduced and I feel full. I don't feel hungry.
Okay. Any history of chest pain or any difficulty in breathing?
No.
Okay. How about your bowel opening and water birth? Is it okay?
Yes.
Okay. Do you have any complaint of leg swelling or clots?
No.
All right. Are you following your GP for any medical condition?
No.
Okay. Are you taking any medication currently?
No.
Any allergy from any medicine or
No.
any substance?
No.
Okay. And any previous history of surgery apart from this?
No.
Okay. Any family history of cancer, like cancer of breast, womb, or ovary?
No.
All right. And do you smoke cigarette?
Yes, I do.
And what about alcohol? Do you drink alcohol?
No.
Okay. And whom do you live?
Yeah, with my partner.
Is he supportive?
Yes.
Okay. May I know, have you ever been pregnant before?
Yes, I have 3 children.
Do you have daughters?
Yes, I have two daughters.
May I know age of them?
Yeah, they're teenagers, like 18 and 19 years old.
All right. Okay, so thank you so much, Mrs. Lawrence, for all this information. Would you like to add anything else?
No.
Well, I would like to perform an examination just want to assess your general condition. Okay, will that
Yes.
be okay with you?
Yeah, that's
Oh,
okay.
okay, so Mrs. Lauren, regarding your further management, for this, we need to get done some investigation. We will offer you some blood test, like we will offer you full blood count to check your blood level and kidney function test and liver function test. Also, we will offer you X-ray lung to see any spread of the disease there. And also, we will offer you a special scan, that is the CT scan. Uh, we will offer you CT scan of chest, tummy, and down below, again to see the spread of this cancer to any other organ. All right. So,
Yes.
but your all investigation will be done. Then your case will be discussed with expert in meeting. Okay, and they will come up with further management plan.
Mm-hmm.
For Mrs. Lauren.
Yes, okay.
All right. So, uh, most likely they will advise you about further, surgical intervention, surgery, and they will advise you staging report me, where we need to have done further surgery, and we need to take samples from different organs and fluid from your tummy. Okay, and it will be a um, completion of surgery. I mean, rest of the, tissue like fatty layer of the tummy and sampling from the different organs and fluid. These all will be sent for further testing. Okay. And also, after surgery, they will decide that whether you have a need of further medication or not, like chemotherapy. Do you know about chemotherapy?
No, like I know the treatment is given for the cancer, so but I'm
Yes.
so much afraid of these chemotherapies. Will I need them?
Yeah, we are not sure at this moment. That will be decided after once they will do your further surgery and the results will come. Accordingly, they will decide whether you have a need of it or not. Okay. So,
Yes.
actually, this chemotherapy is a medication which we give through a drips, and it kills the cancerous cells. Okay. So, if of course it is an anti-cancer medication, it only it is not going to kill normal cells. It is also cancer cells. It also kills sometimes the normal cells. So that's why patient have a other side effects like nausea, vomiting, and also patient feel tired, and also bowel and water work problems. Okay, and also mouth ulcers and infections. Right. So of course we will offer you some other medication to reduce these all side effects. All right. And
Yes.
another radiotherapy. And in radiotherapy, what we do that we give the radiation to kill the cancer cells. And of course, this therapy has got also some side effects like again nausea, vomiting, and also patient have bowel and bladder problem, and also it causes the fibrosis, right? Scar formation.
Okay.
Such sort of the problems patient may face. But these therapies have a more benefit than the risk. They decreases the abnormal cells. In distant area. Okay, so this treatment, of course, will be decided by the specialist. So for further your management, once they will decide, so we will refer you to the specialist. Okay, so going to give you these information leaflets, and also I'm going to fix your appointment with my consultant and with the cancer specialist. Okay, and also I'm going to fix your appointment with counselor. Do you have any questions so far?
Yes. What about my daughters? Can they have this cancer of ovary?
Yes, that's why we need to just get an opinion from the clinical, genetic counselor. Okay, and he will advise you further regarding that whether he will assess their risk and will advise them whether they need to go for the screening of faulty gene or not.
Mm-hmm. Okay.
So, any questions so far?
Mm. Do you have idea about the hot chemotherapy? Will I need that?
Well, I don't have currently, any idea about it, but I will inquire from my consultant. I will fix your appointment with my consultant and will let you know about it.
Hmm. Okay. 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 Good effort, I must say. So don't forget to address the daughters and hot chemotherapy. Can
Yeah,
anyone
I think
explain? Can
the
anyone explain? Just 2, 3
yeah,
lines.
for 2 days I didn't study any single word. I was busy with some other task.
Huh.
That's why today these answers were new for me. I was just listening, and by this I made these
Yes,
answers.
yes.
Very
And
sorry.
no, it's okay. Did the RCOG contact you? Any news about the seat?
No, they didn't.
No. You never know. Sometimes even 3 weeks. Anyway, it's 3 weeks already. Already your October has started. So
Yeah, but I'm
can't
continuing.
say.
I'm
Yes, very unpredictable. You can't say. Maybe they will send a mail.
yes.
So someone can explain what is hot chemotherapy. What do you understand? Just few lines. If the role player asks,
Yes.
okay.
Actually, this is heated chemotherapy, heated medicine, like chemotherapy medicine is instilled after the operation into the patient tummy, and that is massaged for 2 to 3 hours. And after 2 to 3 hours, after mixing well, then it is then the incision is closed, and patient is put on the cooling blanket or mattress, so that there is no harm to patient. And after that, patient needs to be admitted for a few days, and then parenteral treatment, sorry, food would be given through the nasogastric tube.
Yes, the main idea is that hot chemotherapy and hot. So yes, the anti-cancer medications, they are heated up to 40 to 42 degrees centigrade, instilled directly inside the tummy so that any remaining cancer cell can be killed. Now, this hot chemotherapy we are giving only in advanced stage of the cancer. And the systemic side effects are less because the medications, these drugs are instilled directly into the tummy. So there is less risk of hair loss and nausea vomiting. So that is the thing, and still not available in all the NHS centers. Okay. That was the question asked in the exam, and now there is a talk article, and I have my YouTube video on this hot chemotherapy. I will share it in the group. Okay, so this was ovarian cancer station, breaking bad news. So you're in the gynae clinic and patient is Vienna Lawrence. I understand that you had an operation in which your womb and ovaries were removed and sent for the test. Am I right? And you're here to discuss the test results. May I know how are you doing after your surgery and how was your recovering? She will interrupt you. Doctor, I want to know about the result. I have been asked urgently to discuss the result. Yes, I have your test results and I have confirmed your name, date of birth, and NHS number. Do you have an idea about your result? I have serious concerns about your result. I'm afraid I don't have good news for you. The report says that you have cancer of ovary on the right side. Just tell the conclusion. You don't have to say that and this was removed and what is the findings that the left side was okay and the right side has cancer. No, just tell the conclusion in one line because you're going to tell her something very serious. I'm sorry to give you this news. I know it must be very difficult for you. Would you like to call someone to be with you? If you want, we can continue our discussion or I can arrange another appointment. Can I proceed? I would like to ask you a few questions to know more about your health and well-being, and I will also discuss the management plan. Will that be okay? I shall give the written information leaflet about your condition and also involve my consultant in your care. Is there any other concern which you want me to address today? So, can you tell me in your own words why you had the surgery? Have you noticed any weight loss, any change in appetite, chest pain, any cough, difficulty in breathing? How about your water work and the bowel opening? And have you noticed any change in color of urine or any blood in the urine? How about your cervical screening? Were they normal? And may I know, have you been pregnant before? How many children do you have? Any daughters? I have two daughters. Take a note of these daughters. And are you following GP for any medical condition like diabetes, blood pressure? Are you on any medications, any allergy? Complete your surgical history, social history, family history of concern. Okay, if she says grandmother died of cancer ovary, then now the cancer gene test has to be done, of course, because now there is family history also, which is positive. Ask about partner and support, mental health history. If she is feeling very low, put her in touch with the counselors. Thanks for these informations. Would you like to add anything important? So regarding your further management, we would like to offer you some more tests to assess your blood level and how your liver and kidney are working, X-ray of the chest to assess your lungs to see if there are any sinister cells, and special scans, that is the CT of chest, tummy, pelvis, to see whether cancer cells have spread to other parts of the body. This is because your report shows that cancer has reached the surface of the ovary, so there is some chance that it might have spread to other organs as well. Am I clear so far? Any questions? Once all the test results are available, they will be discussed in a meeting by a team of experts. The team will include the senior gynecologist, my consultant, cancer specialist, specialist cancer surgeon, specialist cancer nurse, and the tissue doctor. They will stage your cancer and decide the best management plan for you. It needs to be done as soon as possible within 2 weeks' time. Also, your wishes will be taken into consideration. Now, regarding the further treatment, we have to stage the cancer. So first you will be offered the surgery. Now, just keep in mind that you have to talk about chemotherapy and radiotherapy also. So staging laparotomy, you're going to talk about it first because it is just mentioned right ovarian cancer. It is not mentioned what is the stage of the cancer. So you may need a surgery depending upon the results of your test and as per the recommendation of expert teams. If surgery is offered, then this will be extensive surgery in which up and down cut will be made on your tummy. Samples will be taken from different organs and sent to the lab for testing. This type of surgery is known as staging laparotomy. And since you already had an operation before, so you can have more complications with the surgery, like there is more risk of damage to bowel, bladder, and blood vessel. The surgery will be done by a team of expert surgeons. Every caution will be taken to minimize the risk. And further treatment will depend upon the risk and depend upon the results. It can be either giving you anti-cancer medications, chemotherapy, or treatment by the X-rays, that is radiotherapy. Have you heard about them? So like in chemotherapy, anti-cancer medications are given through a drip. They help to kill the cancer cells. They can also kill the normal cells and cause some side effects like nausea, vomiting, hair loss, and you may feel tired. There is risk of mouth ulcers or infection. So you will also be offered some other medications to reduce these side effects. Treatment with X-ray, that is radiotherapy, is rarely used. Sometimes it can be used after surgery to kill the cancer cells, which may have been left behind after the operation, to help with the symptoms like bleeding, pain, or discomfort. Again, talk about the side effects. So the radiotherapy can cause nausea, vomiting, you can feel tired. There can be some problem with the waterworks. You can have some bowel symptoms like diarrhea, and medications will be given to prevent these side effects. Any questions? I can see you have daughters and family history of cancer, so I would like to refer you to the genetic counselor for appropriate counseling regarding faulty genes running in the family and to see whether your daughters are also at risk of having cancer or not. So I will be giving you the contact numbers, support group numbers like Macmillan Cancer Support, arrange appointment with my consultant within 2 weeks' time, and with arrange appointment with the counselors. I can understand that dealing with cancer can be very difficult, and we as a team are here to help you and support you. There are a few questions which the role player asked in the exam. Why did this happen to me? So it can happen to anyone, even without any cause or risk factor. So please don't blame yourself for this. Am I going to die? This question can be asked in any cancer station. I do understand that it is a very difficult news for you. The word cancer in itself is very frightening, but we have treatment for your condition, and I will discuss that with you so that we can come out with the best management plan. And cancer care has improved a lot. What is hot chemotherapy? So we have already discussed what is hot chemotherapy, and just to show your concern, you can ask her, is anyone going to pick you up and drive home? So until your partner comes, I will ask my nurse to be with you. All this will fetch marks in the communication with the patient. Hot chemotherapy, we have already discussed. Just same line. So I'm not going to read everything. It will be too much. You just have to say 2, 3 lines that in this, what we do, that heated chemotherapy is given. The chemotherapy, that is the anti-cancer medications, they are heated to 40 to 42 degrees centigrade, and they are instilled in the patient's tummy and pelvis. They help to kill off any remaining cancer cells. Now, what are the criteria? Cancer must be advanced but not spread to other organs. And patient's fitness has to be assessed, okay, like before undergoing the extensive surgery and before the chemotherapy. Side effects, that is the only advantage will be that it does not produce the common side effects of traditional chemotherapy like hair loss and nausea. Okay, that's enough. All right,
Right.
so good effort. Now I will need a volunteer. Someone has to come. Yes, Shweta, you can come.
Yes,
It's okay.
I'll
Take it easy.
try.
Yeah, take
Yeah.
it easy. Take it easy.
Yes.
I think we have missed one station somewhere. Wait. Okay. Take your
Yes.
2 minutes, 2 slides.
Yeah. Next slide, please. Next one.
Yes. Right.
Can I start?
Sure. Start, please.
Hello, I'm Dr. Sweta, one of the doctor in Gynae Clinic today. Am I talking to Mrs. Hannah Williams, 62 years old?
Yes.
Mrs. How can I call you?
Yeah, call me Mrs. Williams.
Mrs. Williams, I understand that you are waiting for Dr. John regarding your discussion, what had been done for your MDT discussion, what had been done. And I am really sorry that he is busy in emergency operation. May I continue with the consultation if you want? And I am aware of your case.
Okay, so are you working with Dr. John?
Yes, I am working with him, and he has actually told me to take forward the consultation with you. But if you want, we can arrange another appointment with him.
Okay, that's fine. Yes.
Okay. So, Mrs. William, I have your MDT discussion report, and but as I am meeting you first time, I want to ask a few questions to know more about you. Would that be fine, or you want me to discuss about the MDT diagnosis and
Uh,
management plan?
no, it's okay. You can carry on. It's okay.
Mm-hmm. So, Mrs. William, may I know why the vulval biopsy was done
Oh,
in your
yes.
own word?
Actually, yes, I used to have severe itching down below, and I took steroids for a long period
Mm-hmm.
of time. It was not resolved. Then biopsy was done, and the result showed that I'm having the cancer of the vulva.
Yes, Mrs. William, I am really sorry to know all these things. So, how are you coping up with this?
Yes, I'm in touch with the counselors now, and somehow I'm coping. In fact, I had a meeting with your consultant, Dr. John, 1 week ago, and he told me about like that everything will be discussed in the special meeting, and then I was called today.
Are you in touch with counselors? Like we have Macmillan nurse, Macmillan support group as well.
No, not with the support group, but just with the counselors.
Okay, I'll arrange for that. Okay, so if you
Yes.
allow us. So, so how did you recover after that biopsy?
Yeah, the recovery was fine.
Mm-hmm. So, any weight loss or loss of appetite?
Uh, I think yes, like I am losing appetite, but no, not weight loss.
Mm-hmm. Any chest pain or breathlessness?
No,
Any swelling in leg?
no,
Any pain, any problem with your water work and opening up of your bowel?
no.
Okay. So, Mrs. William, may I know about your so how many regarding your pregnancies and deliveries? How many children you have?
I have 3 children. I will stop you here. Wait, Shweta. There is no information
Yeah.
gathering. Don't ask too much. It's
Yes.
very
Yes. Yes.
focused.
Yes. So, when was? Tell me about your periods.
I will not tell you about my
I think
periods. 62-year-old.
60. Yeah. When? Yeah.
Just ask
Sorry.
about the medical history,
Huh.
LLP. Enough.
So, do you have any problem for which you have been visiting your GP regularly?
No, no,
Any other surgery done in the past?
no,
Are you allergic to anything?
no,
Are you taking any medicine for any other reason?
no.
So, how is the support at home?
Yes, my partner is very supportive.
Okay, and I can see that so it is affecting your quality of life as well, and you are in touch with support group.
Yes.
Okay, so do you have any family history of cancer or clots?
No, nothing like that. You can explain me the result actually. I'm worried about
Yes,
that.
yes. Yes, Mrs. William, I have your report with me, and then I've confirmed that it belongs to you. The report says it has been discussed with the MDT. Do you know what is MDT meeting?
Yes, I was told about that, and I just want to know what management they have planned for me.
Yes, actually, they have decided that in this case, the actually they have you have been diagnosed with vulval cancer, as you told me that the stage is 3A. That means it is advanced. It has involved the water pipe, water bag, and the major part of vulva and the drainage system, that is lymph node. So they have decided that the surgery and the radiation both would be equally effective, but the quality of life would be better with the chemoradiation. Do you know what is chemoradiation?
No, what is that?
The chemoradiation is actually the when the radiation and the cancer killing medicine both are used together to increase the efficacy of treatment. So they have decided for that, and they also so what are your thought on that?
Actually, I don't like these cancer medications. My friend, she had very terrible side effects. She lost all her hair as well.
Your concern is valid, Mrs. Williams. So, but let me tell you that each and every person is different. Each and every cancer is different. So each person respond differently. So let me tell you about both options, and then you decide. Okay, and whatever you decide, we will support you in that.
Okay.
So regarding the surgery, actually, this is going to be a very big surgery, the complex surgery. Team of specialists would be involved in that, and the major part of vulva, that is part of down below, that would be removed, and the water pipe and water bag and the drainage system, that would be removed, and the water pipe would be inserted into the bowel, and that bowel would be and that would be attached to the tummy wall, and the bag called cystostomy bag would be attached to that to collect the urine. So this will be a like a complex thing, and this can cause the psychological trauma as well. Are you with me?
Yes, yes, okay.
And as surgery, as it is a major surgery, there can be a risk of anesthesia, the risk of infection, bleeding, pain, and the injury to other organ like bowel can happen with that also. And then recovery would also be prolonged. So, but benefit is that much of the cancer tissue would be removed. And regarding the chemo radiation, the benefit is that this much of risk of anesthesia, risk of surgery would not be there, but the risk is that with radiation, actually radiation is the high energy X-ray which is given to which is targeted to the cancer cells, and it is destroyed. So the side effect of radiation is that it can cause immediate effect like skin discoloration, skin burn, nausea, vomiting, and sometimes the inflammation of water pipe and water bag can happen.
Mm-hmm.
And also in long term, it can cause the abnormal communication between the water bag and vagina can happen. That can cause problem. And also there is narrowing and scarring of vagina can happen. So that can make the sexual activity difficult and problematic. Okay.
Yes.
And regarding the chemotherapy, it is a cancer-killing medicine, and it can also kill sometimes the normal cells as well. So there are risk of nausea, vomiting, the mouth ulcer can happen, hair loss can happen, and however, we will give the anti-sickness medicine with that, and we will take care of side effect of that. So.
Yeah.
So any other question you want to ask?
No, so any other advice for me?
Yes, actually, MDT has also advised you to stop smoking, as smoking will hamper the healing of cancers as well, and it will affect your health also. And I'll refer you to the oncology department after 1 week, and they will reassess you after. Then will reassess you after 6 months.
Okay.
So I'll give you the written information about that. I'll speak with my consultant, and that's all.
Okay. Thank you.
Thanks for your
All
time.
right. Good effort,
Yeah.
actually. You
No,
were
no,
not.
but actually, yeah,
I,
initially I thought that some information gathering should be there. So because
yes,
I didn't know about, yeah.
yes, yes. Some very, very few lines. No need to ask about children,
Okay.
pregnancy, menopause. No, no, no. We will discuss that.
Mm-hmm.
Very focused,
Yes,
keeping
yes,
in mind the patient safety points. That's all. And
yes.
how you are going to start the conversation. So
Yeah.
that's all. And you can just ask little bit being non-judgmental because they have advised stop smoking. So you can just ask, may I know, do you smoke cigarettes? So you have been advised to stop smoking also. That's all. Not too much. Even sexual history, you're not going to ask directly. When you're talking about the vaginal narrowing and all those things, the side effects of radiotherapy, there you can ask that. I would like to ask you, please don't mind me asking, are you sexually active? So with the radiotherapy, you can have some problem in the sex, and so you have to use a lot of lubricants. Because yes, with radiotherapy, it can happen. Okay. So good thing you did was you apologized. Your Dr. John was not there. And she's a known case of cancer vulva. So yes, you are not going to rush. You have to be very empathetic, speak slowly, use very soft tone. All right. So I would like to apologize first, and because I can see that you have come here to see my consultant, Dr. John, but Dr. John is very busy in an emergency operation. So is it okay? Can I carry on with the consultation? Mrs. Williams, I understand you were diagnosed with cancer of the vulva. I'm sorry to meet you in this difficult situation. I'm sorry this has happened to you. It must be very difficult for you. How are you coping? Do you have enough support? Are you in touch with the counselors? And can you tell me in your own words, how was cancer diagnosed? I'm sorry to hear about that. I understand you're here to discuss the further care plan. Am I right? So before that, is it okay if I ask you a few questions and then discuss the care plan? So just few lines, symptoms of cancer. Do you have any change in weight or appetite, cough, chest pain, shortness of breath, any change in color of urine, tummy pain, waterworks? How about your bowel opening? Are you updated with your cervical screening? Are you following GP for any medical condition? Are you on any medication, any allergy, then any surgery, family history of cancer? Pardon me to ask, Manu, do you smoke? Okay, I'm trying to quit smoking. That's really appreciable. Thanks for these informations. Would you like to add anything important? Then now your main aim, like main task in this scenario is to discuss and explain the MDT letter. So, Mrs. Williams, after your meeting with Dr. John, your case and test results were discussed in a meeting with experts, and they have staged your cancer and they have come up with a management plan for you. So, I will be explaining that. I'm going to give you a lot of information. Would you like to call someone to be with you? So, you have to discuss everything here. That your cancer, the cancer is usually staged from 1 to 4. In your case, it is the stage 3A cancer. So what does it mean? So what it means is like you have to say that it means that it has a spread over a bigger area on your vulva, but it hasn't spread to other organs. Now, here you can just explain to her whatever is written here, that cancer was found in the midline lesion around the opening of the water pipe, and it involves the lower 1/3 of the water pipe as well, and the bladder, which stores the urine, the vagina, and also the left lymph node. So do you know what is lymph node? So what is lymph node? These are small structures and they are part of body's defense system. They drain the fluids from different parts of the body. Am I clear so far? Any question? Okay, then what about the management? So for the treatment, radiotherapy and chemotherapy is recommended. Have you heard about these treatment options? So radiotherapy, it involves giving radiation or X-rays in a controlled manner to destroy cancer cells. Chemotherapy means giving anti-cancer medications to kill the cancer cells, and usually given by injection. And if she says, but I'm afraid of these treatments, radiotherapy, chemotherapy, I want to have surgery. So may I know why? Now, if surgery is done now, then large area of the vulva has to be removed. There is risk of injury to the nearby organs like damage to bladder or bowel. So if you want, it is better to have surgery after radiotherapy and chemotherapy. Even the expert team has recommended you to have radio and chemotherapy and not surgery, because surgery is going to be more extensive, more risky, and there will be more complications. Am I making sense? Radio and chemotherapy will help to reduce the size of your cancer, and after 6 months, you will be reviewed again. And at this time, if you still want surgery, then with the smaller size of cancer, it will be less risky and safer for you. Both surgery and the combined chemotherapy, radiotherapy, that is the chemo radiation, they have same success. But with chemo radiation, the quality of life will be better. Any questions? However, there are side effects of radio and chemotherapy. They kill the cancer cells and they also kill normal cells. That is why there are side effects. You will be offered medications to combat these side effects. So, what are the side effects with radiotherapy? Nausea, vomiting, loss of appetite. They can make you feel tired. Bladder, there can be inflammation of the bladder. Bowel will be affected, causing diarrhea. And you can have soreness and swelling down below. There can be narrowing of the vagina, making sex difficult. So I would like to ask you whether you are sexually active. If so, then you have to use a lot of lubricants. There can be loss of pubic hair as well. With chemotherapy, you can have nausea, vomiting, sore mouth, tiredness, hair loss, and infection. Regarding the surgery, it's going to be very extensive. Now, I will go back. So whatever is written here in the surgery, so what is going to be done? It's going to be very extensive, and this includes removing the whole of your vulva, that is the area surrounding your vagina. Also removing all the lymph nodes, which drain the fluid from the body. Removing of your uterus, both the tubes, both the ovaries, TH and BSO, and anterior exenteration, that is removing of your bladder. And then like even some part of the bowel can be removed, and a hole will be made on the bladder so that like you can pass the urine and stool, and like a plastic bag will, how to explain, let me go here so that I will be able to explain it properly. 1 minute. So yes, what they will do, that a small opening will be made on your tummy to help you pass urine. That is the ileal conduit or urostomy. Plastic bag will be attached to your tummy to store urine because the bladder will be removed. And with this, there is risk of water infection. The area will look different. Risk of the surgery: infection, pain, delayed wound healing, blood clots in the legs and lungs, and swelling in the legs. Sexual desire will be reduced because of the removal of clitoris. You can have painful sex because of the scar tissue from the operation, and it can cause narrowing of vagina. Any questions? Okay, now if she's afraid of the chemotherapy because the friend received chemotherapy and had hair loss, I'm sorry to hear about your friend. And if you wish, we can arrange appointment with the experts regarding your chemotherapy. It may be different from what your friend received and may not cause much hair loss. If there is hair loss, we can offer you the wigs, artificial hair, and the cooling caps. Any questions? Also, the specialist in the meeting, they have advised you to stop smoking, and we can refer you to our stop smoking services. And you will be having appointment with the cancer specialists after 1 week, and they will reassess you. And again, further reassessment will be done after 6 months. Okay, so first appointment is after 1 week, and then reassessment will be done after 6 months. Any questions? No. So we'll arrange appointment with my consultant as soon as possible. Give the contact numbers, support group numbers like the Macmillan Cancer Group. Please don't feel alone. We as a team are here to help and support you. Is anyone coming to take you home? And few lines you can add: dealing with cancer is very difficult, but we as a team are here to help and support you. All right, done. So if there is no history, please don't take the history. It will be wastage of time. Take care of that
Yes,
next
actually,
time.
yeah, I got carried away. I
Yeah,
thought that it is a
I know it must
I
be
was
very
following the
late.
template.
I know.
Yeah.
In the end, we start, I mean,
Mm.
you people, it must be more than 12. Myanmar, it will be 1:30. I know. But I don't know. I can't change the timings. That is the problem. Anyway, so well done, all of you. Don't forget the homework. Please open the talk. See the VIN, okay? I will also do that. If not,
Ma'am, I have
maybe tomorrow. Yes, yes, yes.
the
Complete.
same. No, one exam they've asked about the palliative care, ma'am. It seems like if they has advised palliative care as well as like radiotherapy, like that.
In that same cancer vulva scenario, the
Yes,
MD.
ma'am. This, yeah.
Okay, so palliative care means stage end stage, isn't it? Only then they will be offering the palliative care to reduce the symptoms and all.
So if the same was kept, means we have to say about the only symptomatic care, like that pain,
Yes,
bleeding.
yes, yes. Just read about the palliative care, what you have to say, because
Yes,
that
ma'am.
will be just the supportive care. That's all.
Okay, ma'am. Okay, no
That's
need to advantage or disadvantage. This is the care we are going to give. Like that, we have to what you want. Like that, we have to ask the patient. Like this or that.
yes, yes. If it is chemotherapy, radiotherapy, then we know we can talk about the side effects, the complications. Palliative care is just to increase the survival timing, isn't it? So that the
Yes.
patient can be
To
alive.
just the
Yes,
patient till death, like that. Yeah.
exactly. To reduce the pain and so that she can have even the nasogastric tube and everything is there in the palliative care.
Okay.
So just, okay, so this is also our homework. Just all
Yes,
of
ma'am.
you read it, prepare one paragraph, what you're going to speak in the palliative care. That's all.
Okay, ma'am. Okay, ma'am.
Okay. Okay. Any more questions? All right. So we will meet next Thursday. I will share all the modules and the stations which we will discuss. Okay. Thank you. Good night. Bye-bye, all of you.
Thank you.
Okay. Bye.